The city hums a smoky tune, a saxophone sighs to the moon.
Today we are talking about pandemic emergence and preparedness. What if the next pandemic has already begun, but we simply haven't noticed it yet? Somewhere in the world, a virus may be, exactly, you heard me right. A virus may be mutating, crossing species and quietly spreading, undictated. Pandemic preparedness is not about reflecting to the last crisis. It's about anticipating the next one. And that's the reason we are talking about pandemic preparedness. How are we prepared? Emerging pathogens are viruses and bacteria with the potential to spread rapidly across populations and borders. Globalization, climate change, urbanization, and increased human-animal interactions have accelerated the risk of new infectious diseases. As a result, public health system must constantly scan for early warning signs before local outbreaks become global emergencies. And that's the reason I've brought this topic online for us to have a debate about it. Your opinion is valued, and whatever you feel is relevant, put it in the comment section. But taking from there, I would say preparedness begins with early detection. Surveillance systems now integrate hospital data, laboratory testing, and genomic sequencing and digital health technologies to identify unusual diseases and diseases patterns. So when functioning effectively, these systems allow public health authorities to detect threats early, trace transmission, and also respond before health systems are overwhelmed by the outbreak. So that is why this is a more like a global topic, a global health topic. And however, detection alone is not enough. Strong preparedness requires coordinated response system. So this includes rapid information sharing amongst between countries, regardless of their differences in whatever they believe in. So now, why am I saying this? I'm saying this because emergency stockpiles of medical supplies, trained healthcare workers, and clear communication strategies must be done unitedly. During fast-moving outbreak, delays and confusion can cost lives, and that is not what we want again. We all knew about Ebola that happened, we all know about the COVID-19. So these are things that we've put behind us, and going forward, we just feel that another critical component in public trust and compliance is this one. Even the most advanced response plan fail without community cooperation. Clear transparency, communication helps reduce fear, counter misinformation, and also encourage protective behavior such as vaccination, testing, and isolation when necessary. And also, if you're out there, you're advised to isolate. Kindly do isolate, because you're saving souls, you're saving lives. So that is why everybody needs to be responsible when it comes to a global outbreak. A global topic like this, people need to be prepared. Everybody needs to be on the ball. So now, pandemic preparedness also depends on global equity. By this, I simply means pathogens do not just respect borders. Yet resources are unevenly distributed. Strengthening healthcare infrastructure in low and middle income countries is not charity. It is global safety strategy. So a threat anywhere can quickly become a threat everywhere. That's why we need to be very, very cautious. Infection control is really, really important. We need to also make sure we catch these pathogens early, we get this outbreak tested early, and treat it so it doesn't become a global issue. In conclusion, I will say preparedness is not a one-time investment. It is a continuous commitment by not just the healthcare practice, but also the general public, by strengthening surveillance, response capacity, global preparedness, cooperation, and public trust. Public health system can move from crisis reaction to crisis prevention. The next pandemic is not a question of it, but when. So our readiness will determine the outcome. I hope this message gets to everyone, and I hope everybody is sitting tight, taking infection control very seriously, getting their vaccines, and making sure they are obeying local policies and procedures to make sure we keep our community safe from any form of pathogens and outbreak. Thank you for watching. This is Chrissantus Investment. Kindly like and share my videos, and I will see you in my next video. Thank you. Bye.